Hi, good morning, everybody. Welcome to a special edition of WilmingtonBiz Talk, our live stream show where we interview newsmakers and talk about upcoming events around town from the Greater Wilmington Business Journal. We have a special guest with us today, Ernie Bovio, who at the beginning of this year became president of New Hanover Regional Medical Center, now part of Novant Health, as well as head of Novant Health's entire coastal market. So this is our first chance to kind of sit down and talk with Ernie and talk to him a little bit about why he made the transition here to Wilmington and what his plans are now that he is head of the region's largest employer, as well as the main hospital provider for the three counties. So Ernie, thank you for joining us today.
Yeah, thank you for having me. Glad to be here.
And just to give a brief overview of your background, you have moved here from Wilmington, from Raleigh, where you worked at UNC Rex Hospital, which historically has been the state's oldest hospital there in Raleigh, and then merged and became part of UNC Health in 2000. So part of that's a larger system as well. And also there you had responsibilities for three other hospitals and the market there. So to start us off, can you tell us a little bit about what prompted you to want to make the move from that position there in Raleigh in that market to come here to New Hanover County?
Yeah, it's a pretty exciting time to be joining Novant and New Hanover Regional. The team here is just working on some pretty amazing projects right now to create capacity, build capacity, create access. And those things were interesting to me. The growth in this region, similar to the growth rates in Wake County and Johnston County. And I was just attracted to Novant Health, their commitment to quality and safety, and their commitment to this region and to continue to grow with the community. And when I came down here to visit with the board and the medical staff and the team, just felt almost an instant connection to all of them. And they're doing some pretty amazing advanced medical care here. And so I also had a place at the beach and thought it'd be cool to live and work close to the coast. So here I am.
And can you tell us a little bit about, in terms of your background, so you come from a healthcare executive background, not a practicing medical background, but can you tell us a little bit more about the types of facilities that you have headed up and how those compare or are different to where you are now and with Novant?
Yeah. So I've been in healthcare management, healthcare administration for almost 30 years now. For the past 10 years with UNC Health and overseeing a region similar in size, scale, and scope as the coastal region for Novant Health. It included Wake County and Johnston County and 4 hospitals, 4 surgery centers, a large multi-specialty group practice. Prior to that, most of my life and career has been in Texas. That's where I grew up, where I'm from, and was with Baylor Scott and White for 10 years in the Austin market, overseeing 3 hospitals in the Austin region for Baylor Scott and White. And then prior to that was in Dallas and Houston with Tenet Healthcare, overseeing community hospitals in both of those communities.
Okay, and so what are your goals coming into the coastal market here around Wilmington?
Well, short term is to make introduction, make connections, build relationships, meet with community leaders, elected officials, board members, and medical staff members to learn more about the community's needs, to learn more about the organization, and continue some of the great work that's being done now to, like I said, build more capacity, because the way that this community is growing, we certainly need it, and a lot of effort towards adding hospital beds, operating rooms, medical office space, recruiting more physicians. We're probably going to be bringing in 25 to 30 new physicians every year, and just for the foreseeable future, both primary care and specialty care, to keep up with the growth.
And then speaking of physicians and workforce issues, that's been a very discussed topic, not only here, but with other medical facilities around the country. And in terms of the current workforce situation and shortages coming into Novant Health NHRMC, and then the other facilities that it owns in Brunswick and Pender counties, what's your take on the availability, particularly among nursing, and how those pressures are going to be addressed?
Yeah, the availability is limited, as you know and have heard, and it's been a challenge in Southeast North Carolina, throughout the state, throughout the country. In particular, RNs, the nursing shortage has affected healthcare systems all over the place, and So Wilmington's not immune to that. And what we're working on now is both recruitment efforts and retaining the existing staff that we have. You may have seen recently the $10 million commitment that Novant Health has made to partner with UNCW and Cape Fear Community College to provide scholarships for those going into nursing and healthcare, to help attract more students into the profession, and also to provide funding for preceptors to help train nursing and sim labs to help educate the future workforce. So that's one effort that's ongoing now. We've also developed a nurse residency program that's been very successful. So graduate nurses coming into New Hanover Regional can rotate through a residency program to find a perfect fit for them and get them into the specialty that they're interested in and where they can excel and grow their career. So a lot of effort around the recruitment of nurses. And then on the retention side, I think we've done a really good job of limiting the reliance on contract labor nurses. We've seen a steady decline from a peak a couple of years ago to where we are today. And that trajectory, that trend continues to go down. We've had a number of many contract labor nurses that have converted to full-time employees with New Hanover Regional because they experienced the culture, they like the team and the teamwork, and see some of the neat things that are going on here. So we've been very successful converting a lot of those nurses into full-time nurses.
And you mentioned the $10 million financial commitment Novant made, particularly through scholarships and nursing students. This was made at the same time that the endowment announced $22 million around the same issue, but to other organizations working on a healthcare kind of collaborative. Can you explain how separated are those two initiatives, or is it are you working in conjunction with that new coalition that came together because of that funding this year?
Yeah, they're separate, but obviously, to help with the same cause and results, and we are working with the endowment to help identify other opportunities on the education front. And so yeah, I mean we're working in partnership, but they are separate.
So besides just building extra capacity because of the population growth here and addressing some of the workforce issues as well, are there any other issues or things that you see most pressing as you're coming into this role?
Yeah, I think the like I mentioned, the access is really important. We're excited about the opening of the first Novant Health Michael Jordan Family Medical Clinic in Wilmington. There's two in Charlotte. This will be the first in Wilmington that will it's been designed with the purpose of serving the traditionally underserved communities. We'll break ground on the second Michael Jordan Clinic shortly after this one opens. So we're really excited about that, and it will serve a need that's currently unmet right now. In addition to that, we launched the community cruiser a couple of months ago, and for the same purpose, really trying to get out to some areas that don't have access to provide preventive screening, primary care, vaccinations, other medical services to those areas. So that's just the health equity piece of what we're doing is really important to us right now. We're working on that.
And can you maybe speak to, with your background, you've had cases or instances where you've been a part of hospitals that have changed ownership or branding, and you can fill us in if what that was like. But you are now coming also in a hospital still 3 years after the closing of the sale from the locally owned hospital to a health system owned hospital, and still questions about the differences of then and now, and patients sometimes asking about how, if the quality, how it is different, comparable before and then and now. And again, just coming in from your background of going through similar, maybe not exactly the same circumstances, but when you have culture changes and identity changes, what has been your impression coming into Wilmington?
Yeah. So I have been a part of organizations that have either been acquired or have acquired others, and have been through situations where integration with a different organization takes place, and that's always challenging. I mean, there are cultural changes and disruptions that occur, whether it's information system transformations, transitions, or just policy changes. Organizations work differently, and so if you think back over the past 3 to 4 years, acquisition, pandemic, staffing challenges, integration with the new organization, new president. There's been, some disruption, some uncertainty, and a lot of change that our medical staff and our team members have gone through. And wow, they've done a pretty incredible job, very resilient team to come through. And I've been so impressed with those that I've interacted with here. They're very proud of their profession. They're very proud of their team, and they're proud of our hospitals in the coastal region. And I think they've weathered a lot of that disruption very, very well, and are very excited and enthusiastic by all the work that's being done. Looking forward to the growth. Looking forward to making improvements. And wow, and you mentioned quality. Looking at the quality performance of New Hanover Regional over the past 12 months, and the improvements that have been made, it's pretty impressive. And another one of my priorities and our team's priorities will be to, right now we're a leapfrog B, we will be a leapfrog A based upon our patient safety and quality performance. And also a CMS 5-star is another goal for us as well. And that will just be demonstrated evidence that the teams here are providing the best possible care to the community.
What is its status now when you say it's the goal?
Yeah, we're a leapfrog B, so we're just under the A grade, and our CMS rating, we're a 2-star out of 5-star. And I think you're probably aware that those are based upon historical performances. So the things that we're doing today in terms of quality, safety, and patient experience will not be recognized by CMS or Leapfrog for 1, 2, or 3 years from now. So you'll see the gradual trend and improvement in the scores over the next 2 to 3 years.
And switching subjects real quick, let's talk a little bit about defining what this coastal market is and your responsibilities there. Novant had a long history in Brunswick County and with the hospital and the doctor's offices there. So it's always been a presence there for decades. But it seems like Novant's been moving more into South Carolina as well. And I'm just curious, does that fall under the coastal market as well, or how are you geographically defining that?
Yeah, that's still to be determined. So we have the partnership with Conway Medical Center, and we have a joint venture with them. And so that's the proximity of Conway Medical Center to us is such that we will be able to work together, help them build more advanced services and programs, and also serve as a regional referral center for them as well. Currently, they're sending some of their more subspecialty, high-end tertiary quaternary care to MUSC in Charleston, and we're a little bit closer and offer many of the same services. So that's an opportunity for us as well. And then with the acquisition of the other South Carolina hospitals, Hilton Head and East Cooper, and we expect our South Carolina presence to continue to grow along the coast. That will be a separate region from ours, just given the proximity, and it would be tough to integrate that into our region.
And when we're talking about that footprint, it's another thing that's different than the market that you're coming from. Even though Rex had become part of UNC Health, you still had Wake Med, you still have Duke, you still have the competition for patient services, for certificates of need. So still a very competitive market with several players, even though that it's contracted there as well. Here on our market, we now have one primary operator of the hospitals in Pender, Brunswick, and New Hanover County. So can you talk a little bit about what the difference is, what makes that the same or difference in coming from a very competitive landscape to a landscape here where we have one major provider?
Yeah, well, I feel we have a Novant Health and New Hanover Regional. All of our hospitals have a tremendous responsibility to this community, given the fact of what you just said, that we're, the only hospital in the region. That to me, that just makes us more responsible for making sure that the care is outstanding, excellent, and the best that we can provide. Not that we weren't doing that in a competitive environment, we had to do it there as well. But being the only hospital in town, you know, some may approach that from becoming a little complacent over time and not achieving the results and the performance and the quality and the safety that's appropriate and required. New Hanover Regional hasn't approached it that way. There's just been some challenges over the past few years that have had some impacts that the team has addressed and have been working on. So and there is competition here. There's competition for a lot of our healthcare services, especially on the outpatient side. And I think partnering with the entire medical community to ensure that we're meeting demand and providing all the services that are needed is important. And I intend to do that with the entire medical community.
And so when you think of those services and those lines of services, where do you see the trends coming here locally for you all in terms of expanding more into?
Well, so one of the big projects we're working on right now is going to be focused on our heart and vascular service line, in particular on the 17th Street campus, developing a master facilities plan and modernizing all of our heart and vascular services, the cath labs, the electrophysiology labs, creating more capacity and creating more beds. That's a struggle for us right now. We're full all the time, and so heart and vascular is a big focus for us. The opening of the neuroscience facility last year, that tower, huge success. Filled it up as soon as we opened it. It's very, very busy, and they're doing some great work in the Neuroscience Institute. And I think with the aging population, a lot of the geriatrics are going to be important. And so cardiology services, oncology services, and neuroscience, big focus for us.
And you touched on Scotts Hill and that facility that's being built out there a couple minutes ago. What's the status of that, or what's it looking like for opening?
Yeah, it's looking pretty good. I was up there the other day, and the medical office, that campus is really starting to explode. In addition to the emergency room and the surgery center, a new medical office building is being constructed. It should open towards the end of this year, and it'll house a number of specialties and primary care physicians. The hospital, they're working on the foundation now and the site work, and we expect the new hospital will open towards the end of 2026. Right now, it's slated to open with 66 beds. We're hoping by the time it opens, we'll have license for some additional beds in that facility as well. But yeah, that's going to help with capacity, but that's still a couple of years away. And the work that the team's done at New Hanover Regional on 17th Street with just throughput and length of stay is really helping us move patients through the hospital. Our length of stay has been reduced pretty significantly, and that just allows us to get more patients in the hospital. But Scotts Hill's coming along. It's looking really good. Planning a new patient tower on the main campus with heart and vascular clinical services, and we have a lot of expansion plans for the Brunswick Hospital as well. Another MRI, another cath lab, expansion of some emergency room space, and also at Scotts Hill we'll be expanding the emergency room as well. We'll double the size of the emergency room. So a lot of neat projects we're working on.
Anything in particular in the works in Pender County?
Let's see, Pender County. Yeah, we're also expanding some physician practices up in that area, and some more surgical services will be offered at Pender. They have some capacity in the operating rooms, and we're going to be relocating some surgery up there as well.
Okay. Anything else that we didn't go over in terms of what's looking ahead in the short term, or and then we'll take a pause on your long-term plans, but anything coming up that we should expect to see this year or early next year?
I think we've covered it with the Michael Jordan Clinic and the physician recruitment and adding medical office space to accommodate those physicians. That's the primary focus in the short term.
And then for you personally, what are your top goals in this role?
I think we've touched on a lot of them. It's creating capacity, creating access, improving quality and patient experience, getting patients in and out of the emergency department as quickly as possible, recruiting physicians, and growing services. Yeah, there's a lot. It's pretty good stuff.
In terms of you personally, in terms of your leadership style and your presence there, how would you describe how you are and how you've been, 3 months now in the position about? So what do you think others would describe you as there around the hospital?
Oh man. I hope they would say that I'm accessible and visible, and I also hope. I mean, I'm pretty laid back and chill, and like to get to know our staff on a personal level, and so I'm really trying to do that. And it's hard with 8,000 staff members to do that, but I like to be out on the units, talking to the physicians, talking to our staff, learning from them. That they can certainly guide and advise on opportunities for improvement, and any issues that they have, I can help them resolve. So just relationships and getting to know folks.
What do you kind of see your role, or how do you expect to be in terms of the business community at large?
Yeah, I'm trying to balance all my time with internally with team members and physicians, our board members, and balance that with being out and about in the community and meeting with elected officials, community leaders, and some of the community groups. And I've been able to visit some of the Rotaries, and I've had opportunity to talk to the county commissioners and learn from them, and listening to the business leaders and the needs that they have for their staff and their healthcare concerns. So I think I'm doing a pretty good job of making that balance and learning from all involved, all stakeholders.
Right. Well, thanks for spending the time and talking to our readers this morning. We appreciate it as well. And thanks to everyone who tuned in. If you missed part of this, we'll of course add it into the Business Journal's afternoon news email. And also keep an eye out for an excerpt in it in the upcoming Wilmington Biz magazine, which comes out in just a few weeks, which is our annual real estate issue. So appreciate it. And we will let you know next time we have another special Wilmington Biz Talk coming up. And we hope everyone has a great day. Thanks.
Thank you.